In today's Feldenkrais lesson, I will show you how to improve hip mobility and how to reduce low back pain. So please find yourself a comfortable spot on the floor, press the subscribe button and enjoy the lesson. Please lie down on your back. Rest with long arms and legs and sense the overall contact that you're making with the floor. In particular, sense your low back area and notice the space between your low back and the floor. Most people will have a space there. It might be quite large or it might be quite small. So just sense this area between your low back and the floor. And then slowly bring your legs to standing, so your feet are flat on the floor. And start by lifting the pelvis towards the ceiling and then bringing it back onto the floor again. And repeat this movement a few times. You don't need to go all the way. Just lift it a few centimeters, bring it back down, and then gradually increase the size of the movement. For this lesson, I would like you to imagine that you had a glass of wine standing on your pubic bone. And the goal is to keep the glass of wine standing. So we don't want it to fall and we don't want to spill the wine. So every time you move the pelvis towards the ceiling, make sure that the pelvis doesn't tilt. So we want the pelvis to remain as it is, we just move it up and down. Can you breathe freely while doing the movement? When we focus on a particular movement, we tend to press our lips together or clench our jaw. Can your face remain soft while you are experimenting with that movement? And in order to keep the imaginative glass of wine on your pubic bone, you might have to do the movement smaller and slower. And if the movement is a bit challenging for you, then please feel free to take as many breaks as possible. I suggest that you repeat this movement a few times, but you can always take a tiny break in between each movement. And the next time you're doing this movement, I also want you to pay attention to how your spine is leaving the floor. If we think of our spine, it consists of 24 different vertebrae. And I want you to think of your spine as being like a chain with pearls. And every time you lift your pelvis away from the floor, think about lifting it vertebra by vertebra. Or if you want to use the image of the chain with pearls, you can think about lifting pearl by pearl. So one piece at a time. And when you bring your pelvis back down onto the floor, you can do the same thing. You bring down one piece of the chain, then the next piece. So vertebra by vertebra. And all the while we don't want to spill our glass of wine. And we also want to keep breathing. Please take a short rest and lengthen your legs if you want to, but you can also keep them standing. And if you have your legs lengthened, please bring them back to standing now. And now I would like you to lift the pelvis a tiny bit away from the ground. 3 to 4 centimeters are enough. And then keep the pelvis where it is and move it to the left, back to the middle, and then to the right and back to the middle. And repeat this movement a few times. And again, we want to think about the glass of wine on our pubic bone. So we don't want to roll the pelvis to one side. We don't want to tilt it. The pelvis remains in the same shape. And you just move it as it is to the left, back to the middle, and then to the right. So do the movement slowly and small. And once in a while sense which part of your spine, which vertebra is touching the ground. Then take a short break. Bring your pelvis back down onto the floor again. And again, I want to point out that you can take as many breaks as you want to, in particular if the movements are challenging for you. And then lift the pelvis again, but this time lift it a little bit higher. So another vertebra is the last one to touch the ground. And do the same movement again. Move your pelvis to the left, back to the middle, and to the right. And keep the direction of the pelvis as it is. So if we have a glass of wine standing on the pubic bone, it doesn't spill. So your pelvis is almost like a tray in this exercise. If you tilt the tray to one side or to the other side, the glasses that are on the tray will fall off. Please take another break and bring the pelvis back down. And then one last time, lift your pelvis again, maybe even a little bit higher than before. So a different vertebra is the last vertebra that is in contact with the ground. And if you had your pelvis at the maximum height before, then lift it a little bit lower this time. And again, try to move the pelvis to the left, back to the middle, to the right, and back to the middle. Keep breathing all the while. Keep your chest soft. Keep your face relaxed. And always keep this image in mind of your pelvis being a tray with a glass of wine on your pubic bone. Please take another rest. Bring your pelvis back down onto the ground. Lengthen your legs if you want to. And just notice where your attention is going. If you find that you are suddenly breathing deeply, this might indicate that you have strained too much. So we always want to be able to breathe freely when doing any Feldenkrais exercise. One last time, bring your legs to standing with your feet flat on the floor. And now lift the front side of your foot away from the ground. So you lift the toes away and the front part of your foot, so only the heels are touching the ground. And now lift your pelvis up and down again towards the ceiling and back onto the floor. Think of your spine as being like a chain, and you lift your spine vertebra by vertebra, and on the front side on your pubic bone you have a glass of wine that should remain there. So do this movement a few times with just the heels being in contact with the ground and the front part of your foot being lifted. Breathe freely and make sure to have a soft face. And the next time you bring your pelvis back down onto the floor, also bring your feet back down onto the floor. And then one last time, do the movement of lifting and lowering your pelvis and see if this movement has become easier. Has the pelvis become lighter? Is the movement more clear and more precise? Is the imaginary glass on your pubic bone less likely to drop? And the next time you bring your pelvis back onto the ground, lengthen your legs and take one last rest. And while taking a rest, sense your low back area. Is it closer to the ground than before? Do your legs feel differently? Are there any other changes that come to your mind? If you enjoyed this lesson, feel free to repeat it every day. And of course, don't forget to leave a like on this video. Also take some time to walk around in your room and see if your walking feels any different. Thank you.